What is the evidence for the management of low back pain? The second article in the low back pain series, published in the Lancet in 2018, summarizes the contemporary view on management of non-specific low back pain like this. Doing more of the same will not produce back-related disability or its long-term consequences. The advances with the greatest potential are arguably those that align practice with the evidence, reduce the focus on spinal abnormalities, and ensure promotion of activity and function, including work participation. In this video, the current guideline recommendations for the management of acute and chronic low back pain will be presented. The guidelines generally recommend self-management, psychological and physical therapies, and some forms of complementary medicine. Yet they also stress that professionals should place less emphasis on pharmacological and surgical treatments, and that they shouldn't routinely use imaging or other investigations. More specifically, the evidence-based guidelines endorse the following first-line treatments for acute back pain. Avoid bed rest, stay active, and continue with usual activities including work, and education in contemporary explanations used to study and manage pain, and reassurance that non-specific low back pain is benign. Second-line recommendations include heat applied to the skin, manual therapies, acupuncture, and non-steroidal anti-inflammatory drugs. The recommendations also show that for acute low back pain, there is not enough evidence to neither recommend nor discard the use of exercise, cognitive therapies, yoga, mindfulness-based stress reduction, interdisciplinary rehabilitation, or any kind of surgery or pharmacotherapy. If back pain has persisted for more than 3 months, guidelines recommend to supplement advice and education with exercise therapy and cognitive behavioral therapy as first-line treatment, and also to consider the use of manual therapy, acupuncture, yoga, mindfulness-based stress reduction, and interdisciplinary rehabilitation as second-line tools. Guidelines also recommend that you don't use paracetamol or systemic or epidural glucocorticoids for low back pain, despite how long it's been going on. And in general, all guidelines suggest that any ineffective treatment should be ceased immediately. And finally, very little is known about prevention of disabling low back pain. However, it does seem that exercise, possibly in combination with education, can be used to prevent future episodes of low back pain. You can find more videos from P4Work on YouTube and on Facebook.